Hi, I'm Jerry Franz, your host for Health Matters at Work, a program of community health charities. At Community Health Charities, our goal is to improve the lives of people affected by disability or chronic disease, and we do this by linking employees in the workplace to information from some of America's most trusted health charities. And today's topic for Health Matters at Work is the Gulf oil spill. We're going to be talking with some experts about what might be the potential health impact that has happened since the Gulf oil spill. And I'm happy to have joining with us today. On my left is Erica Ahmed. Erica, welcome.
Thank you.
Erica, you are Director of Public Education with Mental Health America.
Correct.
Great. And then next to Erica is Janice Nolan. Janice,
Hi.
Welcome. Janice is Assistant Vice President, National Policy and Advocacy for the American Lung Association. Last but not least, we have with us Katrina Gay. Katrina, welcome. Katrina is Director of Communications for the National Alliance on Mental Illness. So thank you for joining us.
Thank you.
Today we're going to talk about the Gulf oil spill and what are some of the potential health impacts, both physically and emotionally, the mental health effects as well. And let me start with you, Janice. I'll give each of you a chance. But Janice, from your perspective and from the health perspective from the American Lung Association, what kind of issues are we talking about here?
Primarily, we're concerned at the American Lung Association about the pollution that people are inhaling both on the shore and where the workers might be. Anytime you're looking at things like big burns of oil or oil just evaporating, that can create a lot of very toxic pollutants. And so it's been a real concern for us that people not be exposed to those.
Right.
In addition, anytime you're cleaning up a major disaster, you're using tools that often have diesel-powered engines, and that can add another layer of pollution problems that people are breathing. So there's a whole array of things that we've been watching out for, trying to call attention to in this issue.
Okay, so we have the people that were working on the cleanup. We have the fishermen and others who make their living on the Gulf. We have the people who live in those communities.
Right.
Anyone else that's potentially impacted, or is that pretty much those involved? Anyone else you can think of, Erica?
Beyond the people, the workers, and
the workers and.
I mean, I think there's sort of like a residual effect. You know, it just all depends on, you know, your community and how it's directly impacted.
Okay.
And I mean, certainly, Janice has spoken about the issue of the physical piece, but you know, our concern is the mental health and the quality of life for people as it relates to, you know, that particular arena.
Okay. And Katrina, you have any thoughts on overall here on the impact from a mental health perspective?
Yes. I think it's important to note that whenever a disaster strikes a community, it affects everyone in the community. Mm-hmm. So I think that the impact is really very, very large. And there's been some recent surveys conducted that show 10 miles up coast or inland from the actual incident they're seeing, kind of the effects reach that far over. And I think they reach over for a variety of reasons when it comes to the people's mental health condition. Stress is a challenge for many people and can trigger an array of mental health conditions. And at NAMI, we're most concerned as well with people who live with serious mental illness or people who already are dealing with serious mental health conditions. When you add stress on top of their already existing health condition, it can very, very often be a precursor to an additional episode or some additional challenges and can be life-threatening for many people.
Okay. So, Erica, what do you think? Katrina was mentioning that these impacts can be quite substantial. Are these the kind of things, if they haven't come on already, is it likely that they're not going to, or can there be delayed reactions to any things like this?
Well, yeah, I mean, there certainly can be delayed reactions. Mm-hmm. I mean, in mental health, I mean, it's not like, you know, if someone shoots you immediately, there's a bullet, there's blood. It, you know, doesn't sort of work like that in the space of mental health. But certainly the implications can be, you know, far-reaching. They can be immediate. They can be, you know, and they can be delayed. Okay. Absolutely.
Okay.
So it's also about just managing your stress and about mental health promotion as well.
Okay.
Even lung diseases can be affected long term.
Right.
One of the things we've learned is that sometimes inhaling pollution shows up in the harm of it comes in weeks or months later.
So it sounds like people who live in Gulf communities or are working in the Gulf could develop some health problems, but they may not necessarily link them to the oil spill. Is that correct?
Correct. In some cases, we're in the middle of a recession, but many people are also losing jobs and dealing with a lot of the other sort of peripheral impacts of what's going on. In addition to cleanup crews and fishermen, the entire community is impacted in ways that are a little invisible at times, I think, and that always makes it challenging for people to sort of make something real when it's something they cannot see.
Okay.
The other huge impact is on the children of families that are affected, and the data shows there that it's tremendous, and there's not a clear understanding as to why that is the case, but it's there nonetheless. Okay. So it's a very real and very serious problem.
Yeah. One of the things we've learned from other disasters is that the people who are responding are such good-hearted people that they will deny their own suffering. They will say, I'll put that off. I'm not going to wear that protective equipment. I'm not going to go see the doctor. I can deal with this because I want to help solve this problem. And then we find out later on that unfortunately, they were exposed to more pollution or some issue than they had recognized. And we have long-term health effects that have to be addressed. And some of those can apply to children, too. You have where they may be playing outside and not realize that they're, inhaling something that's not good for them. And so they end up suffering a longer term as well.
Yeah, and those are the negative impacts, I think, of first responders and or people that are directly impacted. It's just that it's a very strange dynamic. Again, people may, be directly impacted by something like the oil spill, and it may not be that they don't realize it. They may realize it, but there are cultural implications. There are barriers. I mean, if in your community people don't talk about mental health, or there's a stigma there, if you don't have access to health care or access to good quality care, then you may be keenly aware that something is wrong or has gone awry and you need help. But it doesn't really matter if you don't have access to those services, or if you're going to be further ostracized in your community by accessing those services, or even trying to broach that subject matter with people in your community.
I think that's a good point to make, because in some of these communities, particularly those that were devastated by Hurricane Katrina, the mental health system, the health system in general, but especially the mental health systems, were decimated. And in many of these communities, they have not completely recovered, and that it really is probably more centralized in Louisiana and Mississippi than Alabama and Florida, but nonetheless, it's still there. These are health systems of care that have been in place that have had huge impacts because of recent budget cuts at state levels and the economy over the last several years, and they're stretched and thin. Okay. And now, with a growing demand and need, you're finding that a lot of people, for many people, the sad reality is there is no one to go and see. So it's one thing to recognize there's like layers of this problem, and it's quite complex. Therefore, there's no really easy solution. But people first need to realize what's happening to them, that it's serious. But for many people, not all, but for many people, they do not have access to quality health care to even go to someone to receive some kind of treatment. In the case of mental health or a mental illness condition, that is a huge barrier.
Okay. Janice, let me come back to you for a moment on the physical aspects again. Mm-hmm. I'm curious, from the conversation I heard today, something came to my mind that I hadn't thought of before. The first responders, or the people who come from other parts of the country to do good, to help. And then they go back home.
Right.
Can they, in that little bit of time, have some negative health impact?
Absolutely. If you look at, for example, 9/11, some of the folks who were most affected were the people who were trying to clean up and help, even more so than some of the folks who were in the initial incident, because they were there working day in, day out. And often these folks work longer hours. I mean, they're committed to getting this solved, or there are few resources, and so sometimes they have to be out there doing that.
Right.
In this case, we're also dealing with a lot of folks whose primary language is not English. And so just communicating the information about their concerns to people is hindered. And I know that some of the federal agencies have been trying to translate materials into Vietnamese or Spanish so that it's more easily accessible. Just translating doctor speak into something that you and I would understand can be a challenge.
Right. A couple of you have mentioned that there certainly have been past oil disasters, perhaps nothing as large as the current the Gulf oil spill. But the Exxon Valdez spill in 1989 is one that many of us remember. Are there lessons to be learned that you draw from there in terms of things that were done well or things that could have been done better, and how we can apply that to helping people in the Gulf?
I think one lesson that we should learn or should be aware of now is that untreated trauma has no expiration date.
Okay.
Someone has been traumatized by a particular event and that trauma has not been addressed, and it still continues. There is no expiration. There is no period of time at which it will just simply, like a physical sore or scab, heal and move on and be better.
Okay.
I would say additionally, in Alaska, particularly speaking with some of our NAMI affiliate chapters there, what they experienced downstream and for years was the need for local connections within the community for people who had mental health conditions. And there was an additional demand and strain put on the volunteers at NAMI that offer support groups and education programs and assist families and individuals in need. And it was interesting shortly after the BP spill became kind of a reality for many people, one of our NAMI Anchorage affiliate leaders called me to say, I would love to talk to them. I know what's going to happen. They need to be really mindful of beginning to be pacing themselves in the community and ready for a long-term, a long haul on this. And in her case, we're talking 20 years of an impact that they realized there. And it was great to see that there was that sort of community connection even within the organization, willing to kind of reach out and offer some assistance to help them prepare for what that would look like. Because many folks in the community, they're the ones that are left there. And a lot of people do turn to those very, very local grassroots community resources that are available.
But also say that it hasn't stopped with the BP oil spill. I mean, there was a major oil spill in Michigan just earlier this month, early in August. And they actually had to evacuate a community because of the off-gassing of benzene and other concerned chemicals from that spill. It got very little attention. I mean, most of our attention has been focused on the Gulf, and understandably. But these things are happening all the time. Okay. And we have got to recognize, and fortunately, we have good science on how to deal with disasters. What we often don't do is pay attention to what we've learned about them, and we have to do that in a better way. And I know that, for example, some of the work done by OSHA and EPA on this, they've really put a lot of resources that they honestly had to pull from other places in order to focus attention and inventory and find out what's going on in the Gulf, and that's great. But it leaves the rest of the country a little less protected when they have to do that.